If you're over 60, the wrong masturbation habits can wreck your erections faster than age itself. A leading urologist warns, 3 specific mistakes are causing more harm than most men realize. Keep them up, and you risk permanent sensitivity loss. Avoid them, and you'll protect your sexual health for years to come. The truth is, masturbation itself isn't the enemy. In fact, when done safely, it supports blood flow, protects prostate health, and keeps sensitivity alive. But the way many older men do it creates silent damage. Today, we'll reveal the 3 biggest mistakes most men over 60 make, and exactly how to fix them before it's too late. By the way, my name is Dr. Emily Carter, and as a board-certified urologist, I've seen firsthand how these habits affect men as they age. My mission is simple: to give you clear, science-backed advice that protects your sexual health, your confidence, and your quality of life. Let's start with mistake number 1, the circulation mistake. Most men, without even realizing it, use a grip that's far too tight. They believe more pressure equals more pleasure, but in reality, what happens is blood flow gets restricted. Erections weaken over time, recovery slows down, and sensitivity fades. Think of it like pinching a garden hose. The harder you squeeze, the less water flows. The same principle applies to blood vessels in your penis. At 60 and beyond, tissues don't recover as quickly. Prolonged restriction of blood flow during masturbation can accelerate erectile decline. The solution isn't to stop, but to adjust. Use a lighter touch, vary your rhythm, and give your body space to respond naturally. Gentle, consistent stimulation supports circulation and helps maintain strong erectile function. Now let's move on to mistake number 2, prostate strain. After 60, the prostate is far more sensitive than it was decades earlier. Prolonged pressure in the wrong positions, like sitting too long, bending awkwardly, or staying tensed up for extended periods, can irritate the gland. Over time, this adds to urinary difficulties, inflammation, or chronic discomfort. Think of your prostate like the engine of a classic car. It still works, but it needs care, not abuse. Too much pressure or too much strain, and performance starts breaking down. The safer approach is to pay attention to your body's posture. Use supportive positions. Avoid sitting directly on hard surfaces for long sessions, and take breaks instead of forcing extended stimulation. Protecting the prostate means protecting your long-term vitality. The third mistake is one men rarely consider until it's too late: overstimulation and nerve desensitization. In younger years, aggressive strokes or even devices may not feel risky. But after 60, nerve endings are more delicate. Repeated overstimulation can dull response, leading to reduced sensitivity and even difficulty achieving orgasm. It's the same principle as listening to music too loud every day. You lose sharpness in your hearing. Push nerves too hard, and you lose clarity and sensation. A smarter approach is moderation and variety. Slow down, change your rhythm, and focus on building arousal gradually instead of forcing it. This not only preserves sensitivity, but often makes the experience more enjoyable. When men stop chasing intensity and instead allow the body to respond naturally, they regain sensitivity rather than losing it. Now, let's talk about the hidden danger that almost no one mentions: ignoring lubrication. Dry friction is one of the most damaging habits older men fall into. At 60 and beyond, skin is thinner and more prone to irritation. Without lubrication, every session creates micro tears in the skin. Over time, this leads to discomfort, reduced sensitivity, and in some cases, even infections. Lubrication isn't optional after 60. It's essential. It reduces friction, protects the skin, and makes the experience far safer. Using a simple water-based or silicone-based lubricant drastically lowers the risk of irritation and allows you to enjoy pleasure without causing invisible harm. It's one of the easiest adjustments you can make, but also one of the most effective. Let's recap the 3 big mistakes. Number 1, gripping too tightly and restricting circulation. Number 2, putting strain on the prostate with poor posture and prolonged pressure. Number 3, overstimulating nerves until sensitivity fades. And the hidden danger, ignoring lubrication, which damages the skin and accelerates decline. When you avoid these mistakes, you not only protect your erections, you extend your sexual vitality. Masturbation can remain a healthy, safe practice long after 60, but only if you treat it with the same respect you'd give to any part of your health. And here's something else worth remembering. Sexual health doesn't exist in isolation. Erections depend on vascular strength, which means your heart, your circulation, your overall fitness all play a role. Men who stay active, eat clean, and take care of their health report stronger, function well into their 70s and beyond. That's why masturbation is part of a bigger picture, protecting not only your prostate and your erections, but your overall quality of life. So, brother, the choice is simple. Keep making these mistakes, and you risk weakening the very things that make you feel alive. Or make small adjustments. Lighter grip, safer positions, gentler stimulation, and proper lubrication. And you'll preserve sensitivity, protect your prostate, and enjoy confidence well into your later years. Masturbation after 60 isn't shameful. It isn't dangerous. But it does require awareness and care. Listen to my advice, and you'll discover that protecting your sexual health is simpler than you think. If this video opened your eyes, do yourself a favor. Don't stop here. Hit subscribe, share this message with a friend who needs it, and explore the other videos on this channel designed to keep you strong, healthy, and confident as you age. Because your manhood doesn't have to decline with time. If you avoid these mistakes, it can thrive.